Van Berkel. I am so excited for you joining us today to talk about building AI ready brands. We're gonna jump in really soon, but why don't you share a little bit about where you're from? So go into the chat. We're going to use the chat to share resources, to see your questions. So go ahead and put in the chat. I'm joining you from a very, very, very cold Guelph, Ontario, Canada. Diane, where are you joining us from today?
Cincinnati, Ohio, which I thought was really cold, but I'm ashamed to say you'd probably just be like, no, you don't know cold.
Yeah, it's unfortunately very cold this week here, but that's all right. Got my warm sweater on, and we're about to
Mhm.
have a super fun chat. We'll get started right at the top of the hour. Also, if you have questions as we go through this conversation, we want to hear them. So go ahead and throw those into the chat. We will get to them and make sure that you get questions answered. Looks like we have people from Orlando, South Carolina, Iowa, also cold. Good job, Heather. Tampa, Louisiana, Texas, oh, Quebec, yes, just a little west of where I am. Kentucky, love this. So put those questions in the chat. Like I said, we want to hear them, see them, and be able to kind of get you the answers as we go through today's conversation. All right, it's the top of the hour. We're going to go ahead and jump right in. Um, for those of you that have seen us before, I like to introduce myself with my knowledge graph. It's who I am and how I'm connected to other things in the world. So if you look at the bottom, you can see I have a technical background. I attended MIT and I have a background in engineering. I am Canadian. I'm the CEO and co-founder at Schema App. And I grew up actually in large enterprise. So I actually spent 14 years at Cisco, where I was a bit of an entrepreneur. So I was looking for what's changing, what's new, and was able to sort of help guide both the executive teams and execution to kind of be early adopters, which is a lot of what I do today. But it also means I understand the complexities of larger organizations like your health systems and sort of all the different cross department work that needs to happen in order to get things done. I know a thing or two about schema markup. We'll mention that a little bit today. But I also used to own a 1965 Austin Healey Sprite, and my actual car was in the movie called Losing Chase that Kevin Bacon directed. Now, hopefully you're smiling. You know that the next time 6 degrees of Kevin Bacon comes up, that you can be the winner because you're 2 degrees now that you know me. But the reason I also share this is that you have inferred that you can win the Kevin Bacon game. And when we think about what AI and search is doing right now, is they're actually looking at your website and how it's all connected using the language of schema markup in order to infer the right answer for your consumer or your customer that's sort of coming to your health system. And so I love to use this as an example because it's really sort of what we do here at Schema App, but also helps you understand sort of why data is so important in this new era. Without further ado, let me introduce you to, or let me have Diane introduce herself. Diane, welcome to the show. And why don't you go ahead and tell us a little bit about yourself?
Thank you, Martha. And I love the challenge of putting this in a knowledge graph because I have a background in graphic design, so I, love data visualizations. Thank you for this challenge. Uh, I am an alumni of Mount St. Joseph University, small liberal arts college in Cincinnati, Ohio, where I am coming from you today. I have a background, a pretty extensive background in healthcare. I spent about 15 years at Anthem Blue Cross and Blue Shield, now Elevance, and at Mercy Health, now Bon Secours Mercy Health. So I've been in your position, or at least in a marketing department, like many of you on the call today. I'm the director of digital engagement at WG Content, which means I help our team and I help our clients build a healthy relationship with technology and with AI specifically. And you can see I'm game for Kevin Bacon. And I am also a volunteer docent at the Cincinnati Museum Center, which, if you've seen the most recent Superman movie, you know was the filming location for the Hall of Justice, directed by a friend of Kevin Bacon's. So there, I'm not going to win you the game. I can't get you quite as close, but
Love
we're
it.
there.
All the connections. And I love it because it's about those meaningful connections, right? Diane,
Exactly.
tell us a little bit about, WG content
Mhm.
and what you do.
Yeah, we are a strategic content partner. So, specifically in the healthcare industry. So, from our inception, We've been working with healthcare companies of all shapes and sizes, health systems of all shapes and sizes, as you can see, medical centers, children's hospitals, as well as health insurers and healthcare adjacent organizations. You see some of them listed here.
Amazing. And for those of you that don't know Schema App, we are a technology platform that does end-to-end schema markup. And we build it sort of in a connected way, just like the knowledge graphs that we just shared. And we love working with healthcare organizations. And what makes us a bit unique is that we don't just have technology, but we have a customer success team that sort of helps guide you to those results. Now, one of the things I thought, instead of going into all the nitty gritty of what is schema markup and why do you care, I thought I'd just talk a little bit about the outcomes that are driven for our customers. And this will kind of give a bit of a framework on sort of what we think and why sort of I'm partnering with Diane today for today's webinar on like how do you prepare for AI and even start thinking about agents. The first area is around demand and visibility, right? So how do we make sure that your health system is showing up in the places that consumers are looking, measured today in, clicks, click-through rates, branded queries, et cetera. But there's a big content place. So you can see the blue box here is like content is actually at the center of it all. And, schema markup actually helps you get that brand authority and control, but it all starts with content. And so that's why Diana is such a great partner for me in today's conversation. And then finally, it's about sort of being ready for AI and agentic. And we'll define what we mean by the agentic web and agents today as we go through the conversation. But really, the goal today is not so much about me talking about what Schema App does, but what are some things you should be asking and learning about as you sort of explore, 2026 and what should be on your list as you prepare for this new era. So I thought we'd start off, Diane, I'm going to kind of pull you in here and first of all define like how do you think about like AI ready brand? Like if we were kind of to say like let's frame like what we're talking about, how do you
Mhm,
define that
mhm.
today?
Yeah, I look at that this as an organization that just doesn't just create content, but creates context. And context is good for humans, but it's also good for AI. It helps AI understand the organization, helps it trust the organization, and choose the organization when it's going to choose who to mention to a user. So I could look at it as in about like 4 layers. So the first being identifiable. Does AI know who you are, where you operate, and what services you provide? An AI ready brand, right out of the gate, um, sends those context clues so that AI can define that accurately. From there, AI ready brands, they can answer the real questions in the patient journey. Their content, their website is full of answers to real questions. And those they're justifiable. Believe it or not, AI is pretty conservative. It doesn't maybe feel that way since it's such a future focused
Advanced tech, yeah.
technology, but it is pretty conservative. So it wants to know that it can back the claim when it mentions you, that there's a reason behind why you are an expert. So it's looking for proof points. And fourth, do other people back that up? Externally, can it see you're mentioned consistently and credibly by other sources? So when all of those things are firing together, that builds that full context that AI ready brands have.
Yeah, I love that. And it's like that big picture. So not just sort of
Mhm.
like thinking of a page or thinking of a piece of
Right,
content, but
right.
thinking of that holistic system, right? And then I
Exactly.
love that it's like inside and out, right? Like it's
Mhm,
not just the
mhm.
things you control, but it's also sort of reputation, right? Or like EEAT is
Absolutely.
like often what we used to talk about in the SEO space. It's interesting as you mentioned context because I really think like if content is king, context is
Mhm.
queen. Um,
Absolutely.
and there's context for AI and also context for humans, right? And I
Mhm,
love like, as you tell that story on your website and connect those dots as I, click through your site and
mhm,
journey through
mhm,
my health decisions. The AI is sort of like connecting the dots, but actually using the language they understand, which is
mhm.
schema markup, right? Which is sort of this sort of vocabulary created by Google, Yahoo, and Bing
Yeah.
in order to explain it. And what I love, just like in our introductions, where we were kind of connecting the dots between our alma maters and,
Mhm.
places we've previously worked. The schema markups bringing that context or defining those relationships between all that amazing content on your website. So on the
Mhm.
area you control, like of your website, I think of an AI ready brand of like, do the machines understand what the
Mhm.
content is
Mhm.
and the relationships of it between the things, including definitions of things like, have you been articulate? And I always love using like cities as a great example. Jacksonville, there's lots of different Jacksonvilles across the US. Like, are we really clear as to which Jacksonville so that you
Mhm.
can be articulate and also making it easy for the machines, right? I think often when we think of
Mhm.
AI ready brands, it's sort of, we're not thinking of like, saving the machines or the big companies money as they try to understand. So that's sort of like how I think about it is,
Mhm.
do you
Yeah,
have the data underneath
right.
the human experience that makes you ready?
And I love it what you were saying there because it does as amazing as AI is, yeah, it needs us to connect the dots. It doesn't infer as well as a human does. It doesn't have all those external things. It doesn't have the billboard down on the side of the road that said, this health system is now named this health system. It doesn't have all those external triggers to connect the dots.
Well, and we've actually seen like when it has hallucinations, like especially AI overviews, we've seen when we did the schema markup and connected it to the story. So like, brought it back into that bigger picture view, that the hallucination went away. So it
Yeah.
is, we have a case study with Wells Fargo on that, but it was really kind of, it is a control point for brands to use to make sure that they're AI ready. Now, I love this question
Mhm.
around shifts, right? So there's like, I
Yeah.
think I always like to think like if people leave today, what are some of the things that they need to be sort of like, am I asking or am I thinking about that shift? Dan, why don't you kick us off with one or two of them that you're thinking of like these are
Yeah.
the shifts that organizations, should be sort of foot forward on?
One of them that comes to mind right away for me is just breaking out of silos. We hear a lot of stories about organizations where social media managers are working over here, and the campaign managers, and and web and PR, and everybody's doing their thing well, but in silos. And I'm not suggesting a restructuring. But what I am saying is, how about bringing those parties together at least once a month to really talk and identify inconsistencies and duplications? Because duplications of workflow, that's where you start to identify where even AI might be able to help you. But inconsistencies in naming of messaging, because all of that really needs to be shored up to be an AI ready brand. The the other thing I think about, and this is tougher, um, how do you define success? Because it
Oh, I
is
love this one.
changing, right? Uh, as you said, we can still look at page views. Google's not going anywhere, but those metrics are changing a little bit. They may be going up or down. So, and as people go to AI search, it's not the only way to define success. So, what's our new metric? And here's an example. It's not exactly a metric, but maybe it is where you start to bring these proof cases forward to your leadership. So we're working with a regional, excuse me, a regional Midwestern regional healthcare system, and they have they had these kind of just disjointed articles. Some of them performing really well. I mean, they could be satisfied with that. But we worked together to repackage them so that these articles really fit together as a story and held together to develop context in that patient journey. They were answering questions now in a clear patient journey. And suddenly this, Midwestern regional health system was showing up in AI overviews beside Mayo. I mean, that's for most of us on the call, right?
Yeah, it's
Isn't
awesome.
that the pinnacle of success? So there's success, and it's sending more and more of these kind of stories up the chain. But
I love
what do you think? Yeah.
Yeah, there's actually a great question from Jesse on here, which is like, should I ask AI, like, what do you know about my brand? And I actually
Mhm.
think in this evolving time, it's actually a great thing to do. And you can do it across platforms. Often what you'll get as like, tell me
Yeah.
the top, I like to use entities or like, what are the top 10 things, our health system is known for?
Mhm.
And then you can do that on a regular basis, right? You can also look at it across the different platforms to see so what it is. And I think like in absence sometimes of, like there's no metrics coming from ChatGPT. This is a
Yeah.
great way to kind of know, like, are you working on those things? And then if it's say there's a gap, one is like, I always like to go to like, well, what pages are talking about that thing that we want to be known
Mhm.
for? And then again, is it optimized with schema markup to where they truly understand
Mhm.
it? So that's Jesse, great suggestion, great idea. I love that. I think the other
Yeah.
piece is that I really think as we talk about measures of success, like that top of funnel is becoming harder to measure, right?
Yeah. Right.
Things like visibility. Now, Google's doing a really good job as usual. They give us impressions, they're including AIO
Mhm.
in that. Hopefully, one day they'll actually allow us to delineate what that is. But I really think it's that bottom of the funnel, appointments booked,
Yeah.
new customer acquisitions. Like those are the things that, like, if your business is good at measuring those are your best measures today.
Yes.
And then I love looking at referral traffic, even though it's not perfect. It's at least like showing you like where you need to invest. For example, people are like, how am I optimizing for ChatGPT? But when you look at the referral traffic, it's usually under 5% of traffic, often under 1% for some
Mhm.
organizations. And in
Mhm.
that case, like you need to be thinking about that plan, but it's not urgent, right? Because it's not sort of
Yeah.
from a
Yeah.
digital standpoint driving as much traffic.
And I'll add to that, something I've been thinking about. Again, it's continuation of measuring some of those brand awareness metrics, because if we go more and more into AI search and you're really fighting to be mentioned, better to lead the conversation, better to have someone be brand aware and say, what does ABC Hospital, what kind of treatments and conditions, or what kind of treatments does it provide for this condition, instead of where's the best hospital? You know, you're leading them, so they choose your brand from the beginning and aren't relying on AI.
Yeah, love that. Two other pieces, the other shift is that, like, I often hear in regulated organizations, like, I don't need to deal with this right now. Like, this isn't going to happen
Mhm.
in healthcare. This is like a trusted area that people aren't going to rely on AI. Well, I'm sorry to tell you, but the data says otherwise. This is a report from this past November saying, what percentage of queries across industries is triggering an AI overview, and healthcare is leading the charge. All right. So healthcare, like Google is leaning in with regards to sort of, showing answers for healthcare. And I just share this because like the consumer behavior has got to lead sort of what our strategy is and what do we need to be looking for. And it's very clear that like they are looking at AIO, they are using those queries and they are triggering those areas. I know you also had some news around ChatGPT. Diane, do you want to share that?
Yeah, yeah. I say in addition to that, if you the don't believe this metric, let me add another one on top of that. ChatGPT just recently launched, or announced, I should say, because it's in a select group right now, but launched ChatGPT Health, and they said that was in direct response to the fact that 230 million people, now that's globally, but still, 230 million people ask health and wellness questions every week on ChatGPT. So it's happening. People are, more and more statistics I see every week. People are even trusting the answers more and more.
Yeah, I,
Sometimes
I I just think
scary,
it's
but
like
that's the
yeah,
fact.
it needs to be part of the strategy, right?
Yeah.
The other piece I like to call out, like with us knowing that that indeed is happening, like have been going away, right? So I don't
Mhm.
know about a lot of the healthcare organizations we work, like we saw a new baseline sort of as of last year. But what's really interesting, we did some kind of first party research here at Schema App, and we found that pages with schema markup implemented outperformed those without. And actually, there was less of a decline on click through rate when you had schema markup. So I love this as like,
Mhm.
if it's a sort of defensive tactic as well as a
Mhm.
proactive tactic as you think about sort of agents and so forth. And the team will share this report if you want to kind of dig more into it. All right, I want to kind of bring us back to the human center, right? Because the
Yes,
human is at the center of healthcare, as we know.
always.
Um, One of the things maybe Diane, you can kind of call out is like, how do we
Mhm.
balance AI with the story needing to be around human focus? Like, what is the type
Yeah.
of content and things like
Mhm.
organizations need to be thinking of?
I think I'll challenge this question for just a moment to say that I don't know that we really need to balance, because the two go hand in hand. Stories are good for humans and AI. So it's really a matter of remembering the structure that's required for AI. So taking that story and structuring it in that way. We spent a lot of 2025 at WG Content, but other places as well, talking about some of those tactics, those structural tactics, where you schemas on the back end, but what on the front end can we do? It's those summaries, those key takeaways, those FAQs, all of those things that now going into 2026 should be as ubiquitous as keywords and meta descriptions, because so the story is there. It's important for both. It's just help AI understand it a little bit more. But the other thing, the other, I guess reality or frame of reference that, or frame of mind that I take to this is that AI can, I don't want to anthropomorphize, I know it's a machine, but it helps me with strategies when I think about the fact that AI is both an influencer and your audience. So what do I mean by that? You know, you can consider it just like you do any other persona. So as you're crafting your stories, think about AI as an entity, a persona that has traits and behaviors and preferences, and apply that. Make sure as much as it's hitting on your story is hitting on every other persona, that it's hitting on AI as well. Then you have to respect that it's an influencer as well. Like I said, it gets to choose who to present to that user. So what are your strategies? Same as you would take for any other healthcare influencer. What are your strategies to be mentioned? So it's a way to, I think, sometimes uh, think, not get overwhelmed in the technical mechanisms of AI, and just approach it like you would any other marketing strategy.
Oh, I absolutely love that because it's then not thinking of, I don't know, I was debating with someone the definition of GEO and LLMO and all
Mhm,
these other
mhm.
pieces. And what you're talking about, I love it because it complements that like bigger picture, right? Like there's
Right.
still going to be other marketing tactics and things you're doing and strategies in order to drive,
Mhm.
appointments and outcomes for the health system. And so this is now just like one of those other channels, right?
Right.
In
Right.
addition to the other things that you already do, right? Whether that be billboards, whether that
Mhm.
be, campaigns out to remind people about coming and getting their mammogram, et cetera.
Mhm.
And I love the idea, although I don't love the idea of it being a person, right? But I understand the
I know, that's
persona,
why I said
right? Like, so well,
I clearly, I know it's a machine.
yeah. But there are some things, and you hit on some of them, like, FAQs, even well-structured pages, like, is one of those things, like, it loves structure, mostly because it makes them more efficient, which makes businesses be able to do it more
Mhm,
efficiently, which
mhm,
makes it cost them less money, but it really kinda helps them kinda keep grounded. And again, like, the schema markup helps build all that human stuff
mhm.
together so that they can do the right inferencing, and that's always why I always come down to, because, again, we're not just doing a pure match here, right? This was, like, one of the other switches, I think, we really need to be not thinking necessarily about keywords anymore, but
Mhm.
more about topic clusters, or entities is sort of a concept that in SEO we use, but these sort of like three-dimensional kind of, groupings of interesting topics that go together. And I think as you think about that layer on, I love that, like the actionable way that you've talked about it.
Mhm, mhm.
Let's kind of, I'm thoughtful about time. We
Yeah,
do have one question. I want to make sure we have time for questions. So
sure.
let's hit on the last piece before we kind of jump into some Q&A, which is what else needs to change as we work towards agentic web. So let me talk about like my definition
Yeah.
of agentic web. So today people are going to ChatGPT, to Gemini, Claude, like all the different kind of platforms, and they're interacting in a conversational way, and it's generating answers. It's often doing research for you. This has sort of been a vision since like 2000,
Mhm,
2001. And it's also sometimes known as a semantic web, right? It's understood. And then, you know, from there we can take action. We're still in this AI kind of like interaction space. Agents are where those actions then can happen. And the actions, actually this great article called The Semantic Web that came out in 2001 on Scientific America, and I'll have the team share this, actually described a healthcare scenario of which agents would then say, I'm taking my mother to the doctor. I need to find a specialist. I need to make sure
mhm,
they're in my, in my insurance. I need to make sure they have, like they're, maybe it's, I'm going to say gynecologist. So I really like it to be a woman.
mhm,
I speak Spanish, so I need them to be able to speak
mhm,
Spanish. But I also like my two kids are coordinating my care. And so it also needs to be within a certain, go to my calendar, find the times that are both
mhm,
available that I can go to within that time frame. So it can't be more than a 10-minute drive, and we're going to ask these really complex
mhm,
questions. And then the agentic part is that that appointment gets booked. The
Yeah.
emails just happen, the bookings get into my calendar. And the way I've been thinking about the agentic web is that there's a lot of ease that comes from this, right? There's a
Mhm.
lot of sort of like all of a sudden all the systems are talking to one another. And that ease, I think, is what makes me most excited about it.
Mhm.
And again, this is something that like I would say like um, companies like us are trying it and using it as we sort of explore ways that we can automate things. In healthcare and finance, like there's of course going to be more caution because of the type of information they're working with. But I love to think about like where are the friction points today in that customer
Mhm.
journey that where eventually agents and also which age range or which population is probably going to adopt this sooner, not like the aged, but perhaps the people taking care of the elderly,
Right.
to where you need to start thinking about what does that customer journey look like in this new world. So I always like to think of it that way. Now, cool.
Mhm.
There's some cool projects from Microsoft that are looking called NL Web that are looking at using structured data to prepare your website for agentic. But guess what? It all starts with content.
Absolutely. And I was thinking that as you were talking about giving your example, which was a great example, by the way, to explain something that's pretty high, obtuse. But it it doesn't mean the human goes away in that, and all of those things. You can also layer into that prompt. I want to make sure that gynecologist um, never makes me feel rushed. That gynecologist always treats me with
Oh, I love
compassion.
this. Yeah.
Then it, where is AI, where is it going to find that information to be able to come back to you with a recommendation and schedule that appointment? How does it know that the person that it's about to book with also hits on all those buttons? And that's stories. That's those stories that continue to proliferate on your website. Those patient stories, those employee stories. That's where it gets that information. So when we're talking about the agentic web, I don't think it means that our humanness disappears. Or at least, maybe that's my hope. But I also wanted to say we've got like just really quickly when we're talking about maybe not what needs to change, but what we need to watch for. Go back to ChatGPT Health for just a moment and say, keep an eye out because it's not agentic. But if you go out and read about ChatGPT Health, TBT Health, if you haven't yet, but the whole concept is that you can connect all these inputs, these disparate inputs of health information, your Apple Health, your Fitbit, your sleep apps, your all that. And if you choose, you can also upload, you know, labs and clinic or notes from your appointments, things like that. I'm not suggesting you should. I have reservations myself. But if you watch this happen, because people will do it, people really are doing it. This is just supposed to give them a more secured space to do that. See what happens. What happens when all of those things are connected? Because it's a little bit of a micro precursor to what you were talking about there, Martha. What happens
So
when
I've
there's
done it.
more information? You have, okay.
Well, because I wanted to make informed decisions and ask
Mhm.
informed questions. So when I sat down with my doctor, I could actually come
Yeah,
with some questions. And also like with the understanding of like maybe it's wrong, but like this is what like I have
yeah.
questions about. So I thought of it as more of like a way to prepare myself to get more value, frankly, from the
Mhm.
interaction that I was having. Um, and agentic web, like good news, like your schema markup is going to help you prepare for that because they're even talking about doing actions in schema markup for agents.
Mhm.
Other things you should be understanding is model context protocol. You don't need to know how to do it, but like it is like an API for agents and for AI. And so as you sort of work with vendors, making sure things are interoperable is
Mhm.
going to be so
Right.
important. And so you can like, do you have an MCP server? Do you have are you planning that on your roadmap? Are things I think you can ask as you sort of are thinking about your MarTech stack and making sure that work's done. And then I think the other piece
Yeah.
is to your point is like again working on that holistic system and thinking about your website not just as an experience but as a data source. And this is like again where I think of the schema markup as a data layer, right? That's
Mhm.
going to be
Mhm.
ready to interact with and give answers to your internal on-site search AI, whether that be your internal sort of support AI, maybe helping your call centers or your administrators sort of answer questions, drive efficiency in the kind of operational
Mhm.
side of the business. And so this is again shifting that idea of what might people you might have thought of as an SEO tactic as being sort of an efficiency productivity tactic and a readiness tactic kind of moving forward. Oh my goodness, that time just like
I
flew
know.
right by.
It's like I have so many more questions. Like, how did your doctor react when you said you'd used it? And oh,
Oh
more
yeah, it
things.
was great. They loved
So many
it, right? Like, and they were like, "Oh, maybe you shouldn't do that." But again, I'm an innovator, so that made sense for me. Diane, if
Yeah,
people want to connect with you and ask more questions, how do they do
totally.
that? And then tell us a bit about the resource you have here.
You can always reach out to wgcontent.com and find more information about, you know, all of our content development strategy services, but as well, that includes AI and how AI can help with your content. But you reach out to me on LinkedIn. I love meeting new people. And yeah, I'll be sure to answer.
Yeah, same with me. Feel free to connect with me on LinkedIn. I always love having a conversation, especially like what stood out. What do you want to know more about? And then my team has put together an amazing resource that captures some of these key concepts around like thinking about and mastering AI search and what are some strategies and the insights you and your team need to be thinking about as we evolve. And we're really committed to innovation, helping organizations stay ahead and learn. Now we have time for a couple questions. There was one question around SNOMED and ICP 10. The answer is if it's on your in your content, then absolutely it can be added into schema markup. And so yes, those kind of best practices. There's actually like a code property that goes in there. Again, everything with schema markup starts with your content, and so actually even going to schema.org and looking at that, we have a ton more resources on healthcare schema markup. So if that is interesting to you, let us know, and we can go ahead and make sure that you get that. Diane, thank you so much for joining me today.
Oh, thank
Thank you
you.
all for taking some time throughout your busy days and look forward to continuing the conversation. Have a great day.
Have a good one, everyone. Stay warm.